हेलो एंड वेलकम टू प्रवासी टीवी। मैं हाँ ਤੁਹਾਡੀ ਹੋਸਟ ਹੈ ਨੇਹਾ ਗੁਲਾਟੀ ਅਤੇ ਅੱਜ ਅਸੀਂ ਤੁਹਾਡੇ ਸਾਹਮਣੇ ਪੇਸ਼ ਕਰਨ ਜਾ ਰਹੇ ਹਾਂ ਇੱਕ ਬਹੁਤ ਹੀ ਖਾਸ ਪ੍ਰੋਗਰਾਮ ਇਲੈਕਸ਼ਨਸ ਕੈਨੇਡਾ 2021 ਤੇ ਆਧਾਰਿਤ ਵੋਟਰਸ ਟਾਕ ਵਿੱਚ ਜਿੱਥੇ ਅਸੀਂ ਤੁਹਾਨੂੰ ਇਲੈਕਸ਼ਨਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦੇਵਾਂਗੇ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਕੁਝ ਕਰੰਟ ਮੁੱਦਿਆਂ ਅਤੇ ਇਸ਼ੂਜ਼ ਬਾਰੇ ਵੀ ਗੱਲਬਾਤ ਕਰਾਂਗੇ। ਅੱਜ ਸਾਡੇ ਨਾਲ ਮੌਜੂਦ ਹਨ ਪੀਲ ਦੇ ਮੈਡੀਕਲ ਆਫਿਸਰ ਆਫ ਹੈਲਥ ਲਾਰੈਂਸ ਲੋ ਜੋ ਕਿ ਸਾਨੂੰ ਕਰੰਟ ਕੋਵਿਡ ਕੇਸਿਸ ਦੇ ਇੰਕਰੀਜ਼ ਦੀ ਸਿਚੁਏਸ਼ਨ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦੇਣਗੇ। Thank you so much, Officer, for joining us today through Skype. I know it's a very tough situation for everybody in the world, especially now that we are seeing the rise of cases again in the region of Peel as well. So could you please tell us a little about how the situation is right now as far as the increase in cases is going?
Thanks so much. I mean, certainly we are seeing a resurgence and a fourth wave of COVID-19 in the region of Peel. And a lot of this is just related to after the Step 3 reopening. Of course, there's a lot more contact and interactions that's occurring. We're seeing a lot of spread not only in households and in workplaces like we did previously, but increasingly in social gatherings and settings, particularly large gatherings such as weddings, funerals, sporting events, life events like birthday parties and baby showers. So I think it's really vital for our residents to ensure that they're doing two things. I think they need to make sure that they're getting vaccinated as quickly as possible with 2 doses to ensure that they have that protection against severity and mortality. And while we're getting there, we still need to continue with the measures such as masking and distancing, getting tested and staying home if we're sick, really just trying to make sure we limit our contact interactions as much as possible by keeping each other safe.
There are some people who haven't got their vaccination, and there are some people who are still hesitant to get the second dose of vaccination. So do you think how are they impacting the current situation?
So right now what we're seeing is that out of all the cases, the most people that are getting sick, and especially the people who are getting hospitalized and passing away from COVID, are individuals who are unvaccinated or under-vaccinated. So that means people who don't have 2 doses of vaccines yet. I think the experience of other countries that have seen a fourth wave before us, for example, in the United States, certainly in the UK, Israel, it almost always shows that the people that have the most severe outcomes and are most likely to get infected are people who are unvaccinated. So we have about 250,000 residents in Peel that don't have any doses of the vaccine yet, and we have about 150,000 that have 1 dose but are eligible to get a second. And so my message couldn't be more clear. If you don't have any doses of vaccine, I really encourage you to get your first dose as soon as possible. Even 1 dose is helpful for trying to reduce severity and hospitalization, but 1 dose isn't enough. You really need 2 doses to have the full protection. So really trying to get all those individuals vaccinated is the best way to ensure that we eventually get to a place where we don't need measures or restrictions at this point in time, of course.
You know, some people are very skeptical about the mixing of doses. Like, for example, if they're saying that they've taken Pfizer as the first dose, they don't want to go for Moderna as a second dose. Do you think it's going to have any impact whatsoever? I mean, does it really matter?
So it doesn't matter. I think the vaccines are interchangeable, and it's similar like the difference between Advil and Motrin. If you needed a painkiller, they're the same ingredient. They're just different brand names. And Pfizer and Moderna, they have slight differences, but overall the same mechanism, and they provide the same protection. That said, of course, while the vaccines are interchangeable, we're now at a point in time where we have plenty of both vaccines. So I don't think that should be an impediment to anyone. They can walk in, they can join our, they can book online, and the sooner that they do, I think the better, to make sure that they are protected before the wave continues to grow.
And what's the age group that you're seeing the most cases in?
So at this point in time, of course, we're continuing to see a significant growth across all of our age groups, but especially in our 20 to 39-year-old age group. This is also not coincidentally the group that is the least vaccinated in the region of Peel. I should be more specific to say it is really our 25 to 39, because our 18 to 24 in Peel have done a tremendous job. They're almost 97% 1 dose covered, which we are hoping will translate to 97% full protection. But our 25 to 39 group, and I know, people are very busy, they've got families, they've got jobs, but honestly, our clinics are open 7 a.m. to 11 p.m. The vaccines are safe, they're very effective. You have to weigh it against the risk of not knowing what will happen if you get COVID-19. I think the grim images from elsewhere in the world, certainly in other countries, just really a reminder of how you never know if it's going to just be a mild illness or if you're going to end up in the hospital needing help to breathe. So take the guesswork and the randomness out of it, get the vaccine, and make sure that you stay healthy, for yourself, for your family, for your loved ones. I think that's really vital for the 25 to 39 age group to hear.
And you also know the season is changing, that somebody does experience a little bit of cold or cough. They try to label it, oh, it's just seasonal, because sometimes it's too hot and sometimes it gets too cold. How do you think people need to differ between the COVID and the regular flu, seasonal flu or something?
The most important thing for people to know is that while COVID is still circulating widely in the community, it's important that if you have any symptoms that you get tested and then you self-isolate. It's difficult to actually tell because the symptoms can be quite similar, cough, difficulty breathing, respiration, fever, those kind of things, right? So it's really vital for people to make sure that they are taking those precautions and getting tested and staying home if they have symptoms. And then, of course, the other way to really make sure that you have protection against both is to make sure you get your COVID vaccine, and then when it becomes available, also to make sure you're getting your flu vaccine as well.
There is a situation in Afghanistan that we are seeing, and a lot of people are being brought into country. At least the efforts are still on. If at all they do enter Peel region, does the city have any plan in place to screen them separately?
So, this is the evacuation is being handled by our federal partners, Immigrants and Refugee and Citizenship Canada, together with the Public Health Agency of Canada. Where asked, we certainly help them in respect of providing vaccines or providing healthcare assistance and all those other pieces together with our partners at Ontario Health. But really, the federal government is better placed to speak to the screening procedures that occur when people arrive in Canada.
Are there any more projections as far as increase in cases are concerned? Do you think the cases are going to increase in the coming days, or do you think we will see a little bit of downfall in them?
Well, I think the reality is we knew that we were always going to see a resurgence with the reopening. When there's more contact, there's more interactions, there's more opportunity to spread. And a disease that spreads from person to person will take every opportunity where there is to spread and infect other people when people come together. So I think, the most important thing for people to remember is that while the fourth wave is climbing, cases are climbing, it is, vaccine is the cornerstone. Making sure that you get 2 doses of vaccine is the foundation to safety. But we also do need to continue to protect those that are unvaccinated in our community by making sure that we're still masking in crowded spaces. We're still making sure we're staying home and getting tested if we're sick, and making sure that, where we are getting together, that if we know people's vaccine status, that they're unvaccinated, that we look at trying to distance or limit contact and trying to make sure that we're not spreading it onto them until they have such time to access the protection themselves. And this is particularly important for children under the age of 12 who are not yet eligible for the vaccine. So really trying to make sure that we can all get vaccinated and all continue to take these measures so that we can limit the risk of transmission to that age group.
There were some new public health measures taken by Peel today, so if you could shed some light on that, some new announcements that were made today.
Yeah, so I think we're getting to a point where we now have 1 million residents who are protected with 2 doses of vaccine, but we have about 500,000 plus residents who are either ineligible or haven't yet received it. And so it's extremely important that we take steps to protect those individuals until they have a chance to access vaccine. As you know, we've been seeing a lot more spread in social gatherings, in weddings, funerals, sporting events, etc. And so it's really important when you have a very big gathering, if there is an exposure that occurs, we are going to be issuing a directive that requires the organizers of that event to provide lists of attendees to us within 24 hours in the case there's an exposure, so that we can do contact tracing very quickly. Contact tracing is one of the best ways to ensure that people that are exposed at risk are advised to take precautions. So that's one directive that will be coming down. We'll also be helping the community, especially those who may have been intending to get timely notification by disclosing any event of over 100 people for which there are at least 2 cases that could have been reasonably acquired at that event, just really ensuring that people can take measures to protect themselves. And then finally, of course, we're calling on all employers in the region of Peel to look at vaccines within their workplace safety policy and figure out, within a vaccination policy, whether they will require employees to show proof of vaccination or how that will work in the event of an outbreak or exposure, but ensuring that this life-saving and this protective intervention is included in their workplace safety plan, their COVID safety plans to continue operating with worker health and safety in mind.
How is the situation in the hospitals? I know there was this point that nurses and doctors were almost on the verge of, giving up or sort of quitting or sort of feeling frustrated as people were not following the guidelines and the instructions. Now the cases did go down and there was a little bit relief seen. Now the cases are up again. What's the situation in the hospitals like? What's the situation among the doctors and nurses?
Well, the hospitals always lag the cases, right? So the cases go up and then eventually people fall sick and end up in the hospitals, 1 to 2 weeks later. So at this point in time, we've only started to see a little bit of an increase in hospital admissions, but it's no longer going down. It's no longer stable at low levels. It is going up again. The other thing you're seeing in hospitals is that the people that are showing up at hospitals are almost always people who don't have 2 doses of vaccine. So people who have either 1 dose under-vaccinated or people who have no doses at all and have not been vaccinated. It is very clear, if for nothing else, the vaccine protects you against severe outcomes such as death and hospitalization, because out of 103 hospitalizations that we had in June and July, 101 of them were amongst people who did not receive 2 doses of vaccine.
Okay, so the schools are going to open very soon. So how is the health department working with the schools and the school boards to implement some of the restrictions and guidelines?
We've been working very closely with public health units across the province, as well as our local school boards and the Ministry of Education, to figure out how to implement the provincial guidance that has been provided around COVID safety in schools. And we're hoping that we'll be able to release information about Peel specifically in the week to come or so, just to help parents prepare for back to school and ensure that kids are safe and that we can keep them in-person learning for as long as possible.
Vaccination certificates, some people are up for it and some people are not up for it. So what's your opinion on that?
I think today I actually reiterated my call to the provincial government at my press conference with Mayor Brown that vaccine certificates are crucial through this turbulent period. The reason why we needed to do broad closures and lockdowns in the past is because we were an unvaccinated population, and in general you couldn't tell who was at risk of infection and who would be at risk of severe outcomes. Now that people are vaccinated, we know that people who are vaccinated are not at the same risk of severe outcomes. And we also know that people who are vaccinated are at reduced risk. People who aren't vaccinated, we know that they're also at risk not only of severe outcomes, but also at greater risk of infection. And so we know that there are certain settings in our community where precautions can't always be maintained. For example, you can't always wear a mask if you're eating or if you're exercising. So the idea of a vaccine certificate is actually about protecting people who haven't had the chance to get the vaccine yet from areas where they can't be protected by other measures to ensure that they are kept safe until they have the opportunity to get a vaccine.
Now let's talk a little bit about elections in pandemic. What do you think it was the right time to call the elections, considering that we are in the middle of the pandemic, the 4th wave, and people as it is are struggling with a lot of issues of going back to work and kids preparing to go to school and still seeing the cases rising again. Do you think this was the right time to call the elections?
Well, I think it's really important to note that the decision to call an election is one taken by our political leaders, so I don't have any comment on the timing of it. I think the important thing as we go into a 4th wave, just like any other gathering or any other sort of interaction, is that it's important for political parties, if they're campaigning, to make sure that they are taking all the precautions that they would at any other gathering, screening, masking, ensuring that people are staying home if they're sick, all that other stuff. And that, of course, people think about how they want to vote. I mean, I know traditionally people might go to a polling station, but we saw, especially, for example, in the United States when they had their election, that mail-in ballots is another way that people can reduce their risk and still be able to express their democratic right to vote.
Do you encourage people to use the mailing process, or should go and vote themselves in person? What do you encourage?
I think for people who are able to make use of mail-in ballots is probably the safest way to ensure that you're limiting your potential exposure and risk on that front. But of course, I would not discourage someone from exercising their right to vote in person, provided that they are following all the precautions and that there is appropriate safety in place, which I'm sure Election Canada will ensure.
Okay, perfect. Is there anything else that you'd like to add as far as new announcements are concerned, or what Peel region is doing as far as the rise in COVID cases is concerned? What are some of the precautions that people can take on a daily basis? I know wearing masks is important, washing your hands, keeping your social distance, but apart from that, some of the little things that people miss in everyday life.
Well, I think the first thing to do is making sure that people get 2 doses of vaccine. I think that continues to be the cornerstone. So we know that there are 400,000 residents out there. If you've got questions, if you're unsure, if you're hesitant, talk to your family and friends, talk to your doctor, consult trusted websites. The vaccines are safe, they're effective, they're much better than getting COVID and spinning the roulette wheel because you don't really know how a COVID infection will always turn out. So I think that's the first one. And then in respect of the precautions, reducing contacts is the other part of this. We're now starting to see the 4th wave come up. We know that schools are going to start up again. If we want to keep our kids safe and in school, if we want to make sure that vulnerable populations are protected, I think we all have to do our part to follow the precautions like distancing, like masking, especially in crowded public places, making sure we're staying home and getting tested if we're sick, and then making sure that we get through this period until such time that we have less and less people who have who are still susceptible to the disease, and we can really get to the other side where this is more of an endemic disease as opposed to a pandemic disease. So it really is about ensuring that people get 2 doses of vaccine, and as the 4th wave grows, continue to reduce their contacts and follow the precautions.
Thank you so much, officer. But before you go, one last question, but it's a very important question for our viewers to know that what do you think how the government has handled the situation of pandemic in the country, and what should be some of the measures that they should be taking for any government that's going to come in power after September 20th?
Well, I mean, I think considering Canada's context, being deeply integrated with the challenges of the response in the United States, I think we've actually managed to come through, as best we can in that context. Certainly, there's areas that could have gone better, and everyone is aware of the challenges that have emerged in long-term care, for example, which I think speak less to the response, but more to just the decades of challenges that system has experienced. I think overall, we as a community, as Team Canada, as Team Peel, have done really well at keeping each other safe, especially just looking at how many people have stepped up to get vaccinated. And I think the most important thing for any government or any leaders to come in is to really look at how do we continue to increase vaccine coverage rates, how do we continue to ensure people comply with measures until such time that we're more and more of us are protected, and then really looking towards the future. What do we learn from this in terms of really supporting things like public health, hospitals, healthcare, and ensuring that we can make sure that people are kept safe in the midst of a crisis.
Okay. Thank you so much. We really appreciate your time, and we look forward to talking to you soon again. Thank you.
Thanks for having me.